Good evening and welcome to Health Live at Seniors Today. We wish you all a very happy new year. And being the first session of the new year, we thought it would be good to have a general session on managing your heart health. Okay, the objective is to focus on the health of senior citizens. And for doing that, we have Dr. Atul Limaye, who's Director, Interventional Cardiology and TAVI Services at the Fortis Health Hospital, Mulund in Mumbai. TAVI, as you know, is transcatheter aortic valve implementation. And perhaps we'll have Dr. touch on it in his presentation. But before I invite him to speak, I'm going to introduce him. Dr. Limaye is trained in the US. He's an interventional cardiologist with decades of niche experience in diagnosing and treating cardiac diseases. Prior to coming to India, he was a consultant in interventional cardiology at the Mount Sinai Hospital in New York. That is until 2016. He is able to dissect complex clinical cases and identify the key competing drivers of an individual's cardiac ailment. He also leads the TAVI program at the Fortis Hospital in Mulund, and one of the few selected centers in India with a high level of cardiac and heart surgery experience that has the expertise and advanced equipment to perform this procedure. Apart from coronary and TAVI procedures, Dr. Limaye has broad interest beyond coronary interventions. He's highly skilled in structural heart interventions, and he's adept at peripheral interventions, including renal stenting and treating all over limb vascular occlusions. He's a national proctor for rotational atherectomy, and he's also a distinguished member of the Royal College of Physicians in London, the American board certified international cardiologist, and fellowships from renowned world-renowned hospitals and medical institutions in the US and the UK he has received. His introduction is very long, and we could well take the entire hour, but I'm going to invite Dr. Limaye to speak. I'm sorry, when we took off for a fortnight 2 weeks back, I had a bad cough, and given pollution levels that we have in our part of the world, it has still not recovered. So I have a slightly bad throat, but I'm going to invite Dr. Limaye. He's going to be making a presentation. Do note that this presentation, which he'll be making, is advisory in nature. Do remember that any advice that is given here is advisory. And in case you do have a serious concern, you should speak to a qualified medical practitioner like Dr. Limaye. Dr. Limaye is available at the Fortis Hospital in Mumbai. And those of you who have questions, please keep them. Watch the entire presentation, and you can ask the question in the chat window after his session is over. This session, as you know, will be saved. It will be edited and put up on the Seniors Today website on Monday evening. So you can always have a look at that. Over to you, Dr. Limaye.
Well, thank you very much for the introduction, and thank you also for the opportunity to speak to this audience today. What I have done is I've prepared a very brief introduction and a presentation about prevention of heart disease in general. So let me go ahead and see if I can share that screen. So just a very brief survey of what is heart disease. So as we all know, the heart is the most hardworking muscle of our body, and it is supplied by these arteries that you see on the screen. So all of us have three main arteries which supply blood and oxygen-rich blood to the heart itself. And therefore, as you can imagine, when any of these arteries get blocked, you have what is called a heart attack, because the blood supply to that portion of the heart supplied by the coronary artery gets occluded, and therefore you have lack of blood flow to that region, and ensuing a heart attack ensues thereby. What causes these blockages to form? Well, these blockages are formed by plaque buildup, which is essentially made up of cholesterol and some calcium. And when you have enough of these cholesterol plaques built up, then you have blockages in the artery. So what I was saying is that these fatty plaques or cholesterol deposits start from as early as 2 years of age, from the first decade. So what you see in this cartoon is a pristine artery when someone is born, and then as habits or cholesterol or risk factors accumulate from the third decade onwards, plaque and cholesterol buildup starts happening. It's not only the heart that is affected, it is other organs such as the brain and the leg arteries that are also affected by the same atherosclerotic process, leading to stroke in the brain and what we call claudication or leg pain when the leg arteries get involved. How big is the problem? It's the number one killer of disease worldwide. We have about 12 million deaths annually, and we all have heard in the newspaper and the news media the alarming increase in developing countries, especially our own country. So, what are the risk factors for developing heart disease? Risk factors are high cholesterol, smoking, an uncontrolled high blood pressure, diabetes, obesity, excessive alcohol, and physical inactivity. There are some things that we cannot change, and those are a family or genetic predisposition to having heart disease. Just a couple of words about what is good and what is bad cholesterol. So the low density lipoprotein cholesterol, the so-called LDL cholesterol, is the bad cholesterol, and the good cholesterol is the HDL cholesterol. The importance of this is that when you do a lipid profile and get blood tests done, it is important to know what numbers you're looking at. Typically, we are looking at the LDL, the bad cholesterol, to make sure that that number is within normal limits. So we talked about physical inactivity. The other big risk factor is cigarette smoking, which not only increases blood pressure, but decreases the good cholesterol and damages the arteries and blood cells. Diabetes is a huge risk factor. It turns out that diabetic persons have a 2 or 3-fold higher risk of developing a heart attack or stroke. In fact, 80% of diabetics will eventually pass away from heart disease. So let's get to the meat of the talk today, which is essentially about preventive heart disease. And I have 4 rules. And if all you can take away from our talk today is these 4 rules, I think you have, done a good amount of learning for today. Rule number 1 is look before you eat. And we're going to talk about diet, what is good, what is bad. Rule number 2, exercise. Just need to get up and walk. Rule number 3, if you're using tobacco products, either chewing tobacco or smoking, we need to stop smoking now. And rule number 4 is know your numbers, by which I mean know your blood pressure number, know your cholesterol numbers, and know your sugar numbers to make sure that you are not diabetic. Let's jump in to look before you eat. So we advise people to eat a variety of fruits and vegetables every day. The more color on your plate, the more healthier your plate is. So you see the plate in the bottom has a lot of reds, a lot of purples and greens, and some oranges and yellows. What that means is that this particular person is having a healthy mix of a lot of colored fruits and colored vegetables. There is thrust on eating more millets, particularly bajra and jowar, because it turns out that bajra, jowar, and other millets like that have a lower glycemic index and are and are felt to be more better carbohydrates for you than the refined carbohydrates that we get in terms of polished rice or polished wheat. We should try to eliminate red meat intake and choose fish over chicken, and be conscious that we don't want to replace our low fats with refined carbohydrates. We should try to avoid refined carbohydrates as much as possible which essentially means reducing the intake of rice, potatoes, and everything associated with rice and potatoes. We should try to avoid soft drinks, potato chips, junk food, processed meats like bacon, sausages, hot dogs. This may well more apply to Gen Z and Gen X than to the seniors. We should try to avoid all kinds of bottled fruit juice, sweets, and in general, eat less salt or avoid adding salt on the table. What are some foods which are very rich in cholesterol and saturated fats? These are the foods that we should try to limit in our day-to-day dietary intake. These are egg yolk, red meat, particularly mutton, butter chicken or batter fried fish, all sorts of milk fat, whether it is ghee, butter, cheese, malai, etc. And beware of the hidden fat in bakery biscuits and patties, cakes, pastries, and samosas. What about cooking oils? Well, it's generally a good idea to have a standard cooking oil which gives you a mixture of mono and polyunsaturated fatty acids. In general, it is felt that some form of rice bran oil or sunflower oil gives us a good mix of both MUFAs and PUFAs. If you had to summarize dietary intake, I'm going to refer to Michael Pollan, who is a very profligate author and has done a lot of reading and research in the scientific literature about all the controversy about all the foods that are supposedly good sometime and then they fall out of fashion. But I think what he says makes a lot of sense, which is eat food, not too much, and if you can, eat mostly plants. I think this is an excellent summary that really tells you that we ought to be moving towards a mostly plant-based diet and try to reduce the intake of all the processed food that is coming our way. This is the kind of stuff which is not food. Let's go to rule number 2, which is exercise. And I think not only me, but the healthcare community in general is a big proponent of exercise. Exercise is a very strong and powerful medicine in and of itself. It helps control diabetes and blood pressure. It helps with weight loss and reduces obesity. It increases the good cholesterol and helps in lowering the bad cholesterol. Regular exercise can halve the risk of heart disease. Blood pressure can come down by as much as 20 millimeters of mercury just by exercise. What kind of exercise? Just walk. You don't need complicated exercise machines or sweating it out in the gym. If we can just walk, what you see here is 1 hour of brisk walking burns about 275 calories. If you increase the intensity of your exercise, naturally you burn more calories. So if you go hiking in the mountains, you're going to hike an hour and burn about 400 plus kilocalories. Swimming, 500 plus calories. And if you get into really high intensity workouts like jogging, tennis, badminton, you can burn as much as 550 plus kilocalories. For comparison, I like to remind myself every now and then, what 300 calories looks like. So 300 calories looks like either one fried samosa or it is 25 minutes of intense skipping. So just think about the penalty that we are paying by eating that one samosa and at the same time not exercising. What is the walking prescription? It is a minimum of 150 minutes a week of brisk walking that translates into half an hour, 5 days a week. You can also reduce the number of days a week you're doing that if you are doing any high intensity activity such as jogging, tennis, badminton, etc. Rule number 3, I really cannot stress this enough that tobacco in all its forms, whether it is chewing tobacco or it is ingested tobacco or it is smoking, is injurious for health. The risk of heart attack starts decreasing within 24 hours of quitting smoking. So I think there is really no excuse, and I really hammer this out at every follow-up visit when I'm seeing patients, to stop smoking now. Rule number 4 is know your number. What are the numbers that are important when we're talking about prevention of heart disease? Those numbers are your fasting lipid profile. And just to know that the desirable numbers of total cholesterol are less than 200, the LDL, the bad cholesterol, ideally should be less than 100, the good cholesterol should be more than 40, and the triglycerides should be less than 200. I think it is a good idea for all of us to have at least one lipid profile done periodically, if not every once in a year, when you're having a health checkup. What is the second number that we should be aware of? We should be aware of our blood pressure. I just saw a gentleman yesterday who jogs half an hour, 40 minutes every day. He thought he was in an excellent shape in terms of his health. He went to see an eye doctor because he was having some blurring of his vision. And it turns out that he had hemorrhages in his eyes because his blood pressure was 200 over 110. And all he had was some minor headache, which he was ascribing to migraine and the fact that he was having a stressful day. So not everybody has symptoms from high blood pressure. It is very important that we measure or have our blood pressure measured periodically to make sure that we have our blood pressure optimally controlled. The next number that we are focusing on is controlling our blood sugar. The fasting sugar should be less than 100, and our after meal sugar, which is two hours after a meal, should be less than 140. Unless you check, you don't know. And I know the old maxims of people with diabetes who get very thirsty and very hungry and have to urinate a lot, but that is not true for everybody. There are people who are running around with blood sugars of 200, 250 who just don't know about it. So it is very, very important that you test and find out what your blood sugar number is. Don't wait for a heart attack to take an action. Don't wait for a second life. We are not cats. So let me reiterate my 4 rules. Number 1, look before you eat. And as I quoted Michael Pollan, eat food, mostly plants and not a lot of it. Number 2, exercise, exercise, exercise. Number 3, stop smoking now. Number 4, know your numbers. Those numbers are your blood pressure number. What is your blood pressure? An ideal blood pressure ranges from between 120 to 130 on the top and between 70 and 80 on the bottom. Know your numbers of cholesterol. Do a fasting lipid profile. Make sure that your total cholesterol is under 200. Know your numbers in terms of diabetes, your lipid profile, and your blood pressure. And I think those are really the cardinal rules of trying to prevent heart disease. I think I'm going to stop there, and we may have some interesting discussions to get into.
Thank you very much, Dr. Limaye, for a very detailed presentation and all the rules that you mentioned. I think it couldn't have been more stark and clear and direct than this, and a good cautionary start to the year ahead. I'm going to just, sorry, somebody. Okay, so we have quite a few questions that have come in. There's one question which is there, and you've answered it, but still, my cholesterol is less than 200. This is Shada Parvale. Should I worry about heart disease?
See, let me tell you the honest truth. And the honest truth is that all the things that I said contribute to heart disease, such as smoking, blood pressure, cholesterol, diabetes, that answers about 50% of all we know about heart disease. What do I mean by that? What I mean by that is that the 50% of why heart disease happens is a black box. Nobody knows. And I'm sure you or other people have heard of people whose cholesterol levels are normal, who don't smoke cigarettes, who are non diabetic, who are exercising, and they are still having heart attacks. What is the explanation for that? There is none. Scientists don't know the full Pandora's box that is heart disease. So, what we do is we focus on what we know. So, what we know is high cholesterol is bad for you. So, we try to emphasize that we should lower the cholesterol. Your risks of developing heart disease are certainly lower if you have low cholesterol, but by no means can anybody stand up and say that you are immunized or protected from heart disease forever if your cholesterol levels are low. And the reason is because we don't know all the drivers of heart disease.
Right. Doctor, we have a couple of questions that have come in about oil. One is mustard oil all right? Fish fried in mustard oil. And what about olive oil for frying?
See, I think in general, the Mediterranean diet, which consists of olive oil, is really the most desirable diet and the most desirable oil to have. The problem with olive oil and Indian food is because anybody who's tried to cook, Indian food in olive oil will attest to the fact that there is an aftertaste to olive oil. And food just doesn't taste the same when you cook it in olive oil. So while olive oil is the healthiest oil considered, I think if you can handle olive oil, there is nothing like it. It is expensive, but it is really the best oil out there. The substitutes to olive oil, which all of us are more accustomed to, are sunflower oil, corn, canola oil, or a mixture of rice bran and other oils. Mustard oil and groundnut oil and coconut oil, which is very popular in South India, for example, are lower on that list of desirable oils. So I would put olive, sunflower, canola, corn, rice bran above mustard, groundnut, coconut.
Thank you. We have a question from Sunita Verma, who asks, can inflating a balloon a day help in keeping the heart and lungs healthy?
Yes, absolutely. I think if you inflate a balloon and all post-surgical patients, for example, are given this spirometer, which you're supposed to blow. So what that does is it inflates your lung volume. It recruits more and more alveoli, which is these gas exchanging small chambers inside your lung. And naturally, when you expand your lung volume, it has beneficial effects not only for your lung, but also for your heart. So absolutely.
Thank you. We have a question from Mr. Bomi, who asks, is it safe to take statins lifelong, as statins can damage the liver, or should we taper down the dosage? Uh, if this is a cholesterol medicine, if the lipid profile is high, I guess he's saying.
That's right. So see, just be aware that statins have been in use for almost 25 plus years now. And there is a rich data, scientific data, which is accumulated that if someone has heart disease, if someone has bypass surgery or angioplasty, or if your cholesterol levels are very high, you must be on statins for the rest of your life. The ill effects or bad effects of statins are extremely rare. I'm going to say 1% of the population will have problems with statins, whether it is muscle pains or, as this particular person has pointed out, liver problems. And the way to check that is very simple. You just have to check your liver profile. If your liver profile is okay, I think I want to stress that you should be on statins for the rest of your life if you have very high cholesterol or if you have established heart disease.
Thank you. We have a question from Vijay Ganduri, who asks, all other parameters well in control, but TMT test positive. How risky is this?
So the treadmill test, the TMT test, is a crude test in general because its accuracy is only about 70%. So 70% of the times your treadmill test is going to be accurate, and 30% of the time it's not going to be accurate. So if you have a positive or an abnormal treadmill test, I think it is very important that you see a cardiologist and let him or her determine whether you need additional testing to make sure whether you are in that 70% accurate zone, or whether you have what is called a false positive treadmill test, where actually you don't have a heart problem. It's just your test that has come back abnormal.
Right. Doctor, I hesitate to take a drug name, but there are 3, 4 questions which are there on this. Is taking ecosprin safe? And is it to keep the heart healthy?
So several years ago, up until several years ago, it used to be thought that everybody should take ecosprin. It's good for you. It lowers the incidence of colon cancer. And in general, it was felt that there was no penalty in taking ecosprin. That thought process has changed in the last 5 or 10 years. It turns out that you should only take ecosprin if you have a strong reason to take it. What are some strong reasons to take ecosprin? If you have coronary artery disease, if you've had a brain stroke, if you've had stents put in, if you've had open heart bypass surgery, if you've had valve surgery done. If you don't have any of these factors, if you are generally healthy, then it really makes no sense for you to take ecosprin. In fact, if you take ecosprin for quote unquote no reason, you may pay a penalty in terms of bleeding, either from your gut or from nose or other areas of your body. So I think taking ecosprin needs to be a conscious, well thought out decision, having partnered with your doctor who has determined that ecosprin is important for you.
Okay. Thank you, doctor. This is not exactly the heart, but allied. We have 2 questions. One is asking from Ranjana Kiran, I have grade 1 fatty liver. And another question from Jagmohan Sani, who says, what are the grade 2 fatty liver precautions? And how can you reduce it?
So, see, fatty liver is again one of the diseases which is skyrocketing in India. And I think the root cause of that is multifactorial. Primarily, I think it is because of physical inactivity and the processed food and the diet that we ingest. And you will be surprised to know, I was surprised to know that one of the leading causes of liver transplant today is fatty liver disease. So, what has happened with all this processed food intake and the lack of exercise, obesity, and diabetes, this has become a pandemic in our country where people are developing fatty liver. And the ways to reverse fatty liver is really to get back to what we were discussing earlier, which is exercise, look before you eat, and let us try and get back to a plant-based diet and exercise more so that this fatty liver gradation doesn't start from grade 1, progress to grade 2, grade 3, and so on, so that ultimately we don't cause liver damage.
Doctor, you mentioned about plant-based diet. So are you saying that it's better to be a vegetarian than a non-vegetarian, or is that the recommendation is not to have red meat? What is your?
Yeah. So I'm going to be careful how I say this. What I mean by a plant-based diet, see, probably about 60-70% of our population describes themselves as vegetarian, and 60 to 70% of people who are vegetarians think that they are eating an optimal diet just because they are vegetarians. This is not true, because most of the vegetarians that I see in my hospital and clinic are vegetarians who are eating samosas, dahi vadas, bhallas, chaat, mixture, farsan, sweets. They are all vegetarians. but they are not eating a healthy diet. So if you have a diet which is predominantly plant-based, what I mean by that is you are predominantly eating, raw or cooked vegetables and fruits predominantly. And if you eat some chicken and fish, I'm okay with that. What I'm not okay with is this vegetarian diet that I described to you, and the other flip side of it, where somebody is eating a lot of processed food along with unhealthy red meat, mutton, fried chicken, butter chicken, things like that. I think what I'm saying is that I'm okay if you're going to eat some chicken and fish as long as you're having a predominantly plant based diet.
Right. We have a question from Bala Ravi, who asks, my husband has pain in the left arm and chest. Lipid profile is normal. Could it be heart related or muscle or gastric pain? He takes Zerodol and Ecosprin tablet. Is it right?
So we were just discussing the use of
Right.
EcoSprint. I think, as I said, we ought not to be cavalier about taking EcoSprint. It's not good for everybody. I think it needs to be a joint decision with your doctor. As far as your left arm pain is concerned, as you all know, left arm pain can happen from a variety of illnesses, musculoskeletal, acidity, acid dyspepsia. So I think it behooves, someone who is having left arm chest pain to really have it evaluated, see a doctor, figure out what it's all about.
Right. Doctor, one last question that has come in from Mr. Anil Singh. Is high hemoglobin, 18 plus, is it good or bad? And no issue with respect to heart if a person is not having BP or diabetes?
So a high hemoglobin in general, any male person who has a hemoglobin above 16, it's generally a good idea to have it checked. Smoking, for instance, can raise your hemoglobin level because you're hemoconcentrating. So a very high hemoglobin level is not healthy for you. I think a high hemoglobin level can sometimes be a marker of some underlying blood problems. So I think it's a good idea for this particular person with a hemoglobin of 18 to have it evaluated with a hematologist. They'll run some tests and tell you that your HP of 18 is normal for you or it's not normal. I think it's something that needs looking into.
Right. Thank you. Doctor, you mentioned about the various times and tests that one needs to do. Just to recap that, you mentioned about how often should a senior citizen go to a doctor, go to a cardiologist. Is it once a year? Is it once in 6 months? And what about the preventive tests that one should look at? For instance, somebody asked whether one should do a 2D echo. Which are the tests that one should do on a regular basis?
See, I think I'm generally not in favor of doing these health checkups every 6 months or a year. I think it's unnecessary. Having said that, there are also people who have never had these tests done. I think once you become a senior citizen, once you're 60, and if you've never had a health checkup done before, I think it's a good idea to have a health checkup done, which encompasses a fasting lipid profile, a fasting and postprandial sugar. If you go have a health checkup in any hospital, they will naturally do a blood pressure screen. So you will come to know if you have high blood pressure or not. The health checkup typically involves doing a lipid profile. So you know what your cholesterol number is, what your sugar number is, whether or not you have blood pressure or not. Most of these health checkup packages come with either a treadmill test or a 2D echo. I think if you have one 2D echo and it is completely normal, I don't see a reason to repeat that for the next 5 years. So if you are 60, if you have a battery of tests, and let's just say they're all normal, then I think you are okay to wait 3-4 years before you do the next health checkup done. If some problems come up, then I think you should tailor your next health checkup based on what problems were identified. Was it found that you had high blood sugar? Was it determined that your cholesterol levels were very high? Did you have an abnormal stress test? Did you have an abnormal 2D echo? Then your next test should be tailored to what problems were found.
Right. Thank you, doctor. One of the things that has happened in the recent years is that the fading away of the general physician, the family doctor, as one would say, and who one would turn to anytime need some advice, even if it's something which is very basic. So, you know, what would you recommend for people like these? Most of our seniors would be having a family doctor, but just in case you're thrown in a situation where you do not have a family doctor, then what does one do?
Well, I think, all hospitals have something called a health checkup, an executive health checkup. There are
Hmm.
various names for these tests.
Right.
Some of them are comprehensive, so they cost a little more, but they'll do an abdominal ultrasound, they will do a bone densitometry, etc. I think a basic health checkup, which involves some basic tests that we described, is easily and cheaply available at most hospitals in metro cities. I think it's a good idea for all senior citizens to have at least one such health checkup done, so they get a baseline report card of what their health status is. And as I said, I'm not a big proponent of doing health checkups, very, very frequently, but I would definitely propose to do at least one every 5 years or so.
Right. Thank you, doctor. Thank you, doctor, very much for this amazing session that you've taken. As I mentioned earlier, this session will be recorded, has been recorded, and the edited video will be up on the Seniors Today website on Monday evening. Thank you very much to Dr. Atul Limaye and the Fortis Hospital team to facilitate this, and to all of you here, thank you for joining us here. And we will be back next Saturday at 5 p.m. as always. And I hope to join with a better throat. Thank you very much.
Thank you. Good night and Happy New Year, everybody.
Thank you.
Subscribe now and press the bell icon. Never miss an update.